In an article titled "A Case Report Pavlovian Conditioning as a Risk Factor of Heroin Overdose Death," a case study was conducted for an individual named KJ who increased an amount of heroin beginning in the year 1995. After rapid progression of heroin usage, it eventually led to death. When KJ first started using heroin, he was consuming half a gram every week. Within 6 months, half a gram turned into a gram per day. So pretty much a progression, and also, maybe KJ was looking for a similar effect that was foreseen through consuming a substance, and increasing a substance can oftentimes help with producing the same type of effects, because there's tolerance factors that are involved. At the point where KJ was injecting every day, no physical symptoms were apparent. KJ was hospitalized at one time for overdosing on heroin. However, agonist opioids were not deemed as being a necessary part of a treatment intervention. During the overdose, KJ had a blood morphine level of half a gram. In the year 1997, KJ decided to seek out treatment interventions with his wife at the age of 26 years old at the Drug Prevention and Treatment Center. Both him and his wife sought out interventions for heroin dependency. Before being admitted for treatment, they had been evaluated one time before without much success. At that time, the admission process, no abnormal brain processing functions were found, and no mental health conditions. During January 8, 1999, KJ's wife had a recollected memory that the day before KJ's overdose death, KJ and his wife had decided to begin a withdrawal process from heroin. On January 9, 1999, KJ's wife had stayed at home and KJ was out to attend work. When KJ was traveling to work, KJ decided to change his mind, pretty much isolated himself in this decision, and he bought heroin from the same drug dealer that his friends had bought the heroin from. And the medical report and recount of what happened from his friends who consumed drugs pointed out that KJ went to a drug dealer and bought that shot of heroin. And basically, KJ decided he would not return home with heroin as he normally would. However, he went to a public restroom at a common place within the Budapest metro station, where he injected the same amount of substance, which is half a gram, the day before. The authorities pronounced KJ dead after they had called out and found him. KJ died from a heroin overdose. The lethal after effect may have resulted from a response to classical conditioning of drug tolerance. So pretty much the brain processing system that processes the drugs, and when tolerance occurs, there's a lot of factors for overdose. When heroin is injected in an unfamiliar environment, the tolerance level is not implemented due to an unconditioned response for substance consumption. Therefore, the normal amount of substance usage becomes an overdose, which then leads to death. Individuals who inject heroin may have a much greater chance of survival if the individual is well equipped with the knowledge of preventing a conditioned overdose death. Therefore, providing educational components towards harm reduction interventions on conditioning responses may provide many benefits for reducing the risk of overdose. Also, discussing tolerance within harm reduction techniques can also provide many benefits for individuals who are injecting heroin. The more aware an individual is of how conditional responses work, the more likely an individual will be able to establish safe measures in reducing harm. The implications for the article in working with those who are suffering from opioid addiction is to provide educational components on how injecting substances in unfamiliar conditions is dangerous and puts an individual at risk for overdose. An individual who injects substances should be provided educational components on the detrimental effects that may take place within the brain's functioning in response to these substances. Providing individuals who inject heroin with education of how to reduce risk may provide motivational factors for substance misuse. Also, increase mortality rates because an individual is proactive in taking care of their health. By providing intervention strategies that address a patient's concerns regarding overall health conditions, a patient may become more receptive in seeking help and interventions before the condition has progressed. During a conditioning response of the brain's operational system, a brain's cognitive functioning is expecting the injection of heroin within a same setting. However, when the individual consumes the substance at an unfamiliar location, the cognitive processing that takes place does not address the same effects, but rather an overdose of a substance. It is of critical importance that when consuming a substance, an individual injects the substance in the same setting due to brain processing system. I would explain findings of the research to a client who is experiencing an opioid addiction by first addressing how quickly a substance may develop into an individual's bloodstream. By addressing the time an individual may experience certain types of effects from consuming a substance, an individual may be more proactive in addressing individual health concerns. An individual may develop a more thorough understanding of what physical sensation an individual is experiencing by injecting the heroin and how a body is processing chemicals. When an individual is aware of what may be happening physically within the body, the individual may pursue interventions regarding overcoming substance dependency. The practical advice I would offer is how heroin negatively impacts individuals' overall mental health processing. An individual may not fully understand what may happen through different stages of substance misuse, which will be a critical component to address through intervention strategies. There are a multitude number of factors that will need to be addressed for making sure that overdose does not happen. Some variables may include genetics, where and how the substance misuse takes place, and how rapidly the substance takes effect. When an individual is at a prone risk for developing substance dependency based upon genetic factors as well as environmental factors, the individual may be more prone to risk for overdose. When an individual develops drug tolerance, there is a decrease in the response received from a drug. If an individual desires the same effect from a substance, the individual will need a larger dose of the substance. However, an individual may also experience a more intense experience through conditioned response system, which is preparing for the similar amount of dosage for a substance and a similar location. Therefore, individuals who inject heroin overdose for the first time are also at risk. The individual is not accustomed to consuming the drug in a certain fashion. The brain may be more prone to shutting down, which will also deplete oxygen supply. An individual may not be fully aware of what may happen during the brain's conditioned response in the consumption of a drug. As an example, mixing drugs can send different signals through various neurons and the brain processing system, which creates a multitude number of mood changes and risk for overdose. An individual may develop tolerance and seek more of a drug to experience a similar effect and develop an increased risk of overdose. An individual may decide that they would rather inject a drug alone instead of with others, which puts the individual at risk for overdose due to being isolated from others. An individual may also not fully comprehend the purity and potency levels of certain substances, which also puts the individual at an increased risk. Also, depending upon the overall health conditions of the individual injecting heroin, The substance may create more complications for certain health conditions, such as injecting heroin when an individual has cardiorespiratory health conditions or other physical ailments or conditions which can deplete the oxygen levels even more. Providing intervention strategies that involve educational components of heroin overdose may reduce the risk and help individuals to overcome substance dependency. If an individual continues to use substances, a harm reduction approach may be the most beneficial. So pretty much, addressing all the different things that happen through tolerance levels, cognitive processing, all of these things will need to be addressed through intervention strategies.